Hey everyone, I'm Dr. Amir, a medical doctor from Orange County, California, and I specialize in the art of aesthetic medicine. And today I want to talk to you about a revolutionary medication that I'm sure you've heard of, and that's making a significant impact in the fight against weight loss and obesity, which of course is Mounjaro, also known as Zepbound. It's my personal favorite weight loss treatments. I've tried it all myself. My office staff has used it, and many of my patients have used it and have reported the highest amount of satisfaction with this treatment. Of course, a common question that I get is how does Mounjaro work? So, Mounjaro is one of the newer medications that belong to a group called GLP-1s, like Ozempic, which were first made to help people with diabetes. So, GLP-1s are like messengers in your body that tell it to do certain things like make you feel full. And Mounjaro is special because it not only uses GLP-1 messenger, but it also uses another one called GIP. And here's how it works. So normally when you eat, your body sends signals to your brain to tell you that you're full. So Mounjaro boosts these signals so you feel full faster and you don't get hungry as quickly. By hitting both the GLP-1 and the GIP messenger, Mounjaro makes these signals even stronger, which helps you eat less and to be satisfied with smaller portions and be full for a longer period of time. So, in simple terms, Mounjaro helps you lose weight by making you feel full sooner and keeping that feeling of fullness for a longer period of time. This double action approach makes it a more effective treatment compared to some of the other weight loss medications out there like Ozempic and Saxenda. Studies have shown that it outperforms these previous medications that we mentioned in both the consistency and the amount of weight loss. In a 2022 study that was published in the New England Journal of Medicine, researchers looked at over 2,000 patients to see how well Mounjaro works for weight loss. They divided the patients into 4 groups. One group got the placebo or the fake treatment, and the other 3 groups got Mounjaro 5 milligrams, 10 milligrams, and 15 milligrams. All the patients also made some lifestyle changes like eating healthier and exercising more to boost the results. But the results, nonetheless, they were absolutely amazing. The group that took the placebo only lost about 3% of their body weight, which is still fantastic, but still not enough. But the group that took the 5 milligram of Mounjaro lost 15% of their body weight, and those that took the 10 milligram lost 20% of their body weight, and the 15 milligram lost a whopping 21% of their body weight. And that's absolutely mind-blowing. To put it simply, the people who took Mounjaro lost a lot more weight compared to the ones who didn't take the medication. These results are much better than what we usually see with other weight loss medications, such as Ozempic and Saxenda. But if we put them into comparison, so for example, phentermine results in about 5% weight loss, Saxenda about 8%, and Wegovy and Ozempic, which are your semaglutides, around 15% of weight loss. Mounjaro is administered weekly and shows around 20% weight loss at the therapeutic dose, as we said. So we've even seen success even in patients who aren't significantly obese, but just want to lose that stubborn 10 pounds that they always wanted to get rid of. So the medication does come with some side effects, which are generally mild, such as upset stomach, including nausea, vomiting, diarrhea, constipation, and the occasional feeling of tiredness and at times musculoskeletal pains. Personally, when I tried the medication, I didn't get any of these side effects. If anything, I felt more energetic and clear-minded. I've only tried the medication for about 5 weeks or so. I lost about, I think, 13 or 14 pounds and haven't had more treatments for about 4 to 5 months now. And the weight loss has stayed and it's been stable. In my practice, I have patients who experience all of the side effects, and I have some who get just a few of the side effects. It could be ranging from a mild to a little bit more severe, but it's really hard to say how one will react to the medication because, of course, each person is different than the next. So it's no way to know until you actually try the medication. But now let's talk about some fascinating developments in regard to these popular injectable weight loss medications that just came out. So nearly 10 million Americans are using these medications to shed either extra pounds or manage diabetes type 2. And a new study suggests that these medications may also lower the risk of 10 different types of cancers. And that's absolutely crazy. It's quite an exciting discovery. These weight loss drugs have been noted for cardiovascular benefits, of course, which reduces the risk of heart attack. And now we're seeing potential anti-cancer benefits as well with these medications. This was a retrospective study examined the records of about 1.6 million people across 15 years, and it found a significant reduction in 10 out of 13 types of cancers, including gallbladder cancer and liver cancer. So is it simply that losing weight reduces cancer risk? That's part of it. Excess fat increases the inflammation and cell turnover, raising to increase in cancer risk. However, the exact science behind the reduction of these cancers are still really unclear. These particular studies was limited to those with type 2 diabetes, but it certainly opens the door for further research in this area. Other weight loss medications or methods like bariatric surgery also show a reduced cancer risk as well. So some might hear this and think that these drugs are a quick fix to reduce cancer risk. To a degree, yes. If you have family history of cancers or previous cancer diagnosis and are overweight, discuss these medications with your doctor. It's crucial to get professional medical advice tailored to your specific situation. It's important to talk with someone that has experience with these medications before. Unfortunately, the study didn't show a reduced risk of breast cancer, which is one of the big topics. Breast cancer remains at the top of the cancers that, unfortunately, is the cancer killer for women. And while it's linked to obesity, this study didn't really show a reduced risk of breast cancer. So Mounjaro, as we said, it's a real game changer when it comes to fighting obesity and helping with weight loss. It's super effective, but there's a catch. For the best results, you of course need to combine this with healthy lifestyle changes. That's always important. This means eating a balanced diet, exercising regularly, and making other positive changes in your daily routine. Mounjaro can give you a big boost in losing weight, but to really make it work, you have to do your part too. I have clients that talk about how it has significantly improved their mental well-being and overall how happier they are. So of course, when you lose weight, you feel better about yourself. You look at yourself in a more positive view, and that can cause a significant improvement in overall your mood and mentality as well.